Hi guys, welcome to another episode of Hong Kong Sports Science YouTube channel. So we're here today in Hong Kong Sports Clinic. I'm Joe March, I'm the principal physiotherapist of the Hong Kong Sports Clinic. And today I'm going to be talking you through some common pains that in the knee that you get with running, so common knee pains that come with running that I see. So I've got Vlad Excel with me, who's my friend and patient, and I'm going to use him today to demonstrate some of the exercises and stretches that I'm going to give you as homework. Now, pain in the knee comes in many different forms, so the location varies quite a lot, but quite often it comes from the same problem. So every time someone comes in with knee pain, I tend to think, okay, the pain's different, but quite often the cause is the same. So I'm going to talk you through the most common causes, and I'm going to give you some things that you can do at home that'll be able to fix, I'd say, 80% of you people out there with knee pain without having to actually see anyone. So we've got the most common locations are the outside of the knee. So just as this band here, the IT band, which most of you runners out there will know what it is, crosses over the knee. It's called ITB friction syndrome. This one's quite a sharp, painful one, and it happens quite often when you bend your knee downstairs, or even just bending it quite often if it's really acute. Then we've got something that the textbooks called jumper's knee. So that's usually the patella tendon at the front, and there's a tendinopathy of that patella of that tendon there, or tendonitis as they used to call it. And then the third one is inside of the kneecap. So your kneecap's here, kind of below and inside. There's I guess a mysterious pain there that a lot of people feel. And I find this is probably the most common area of pain, but it's also the most missed in terms of diagnosis. So sometimes doctors, physios think it's meniscus, they think it's nothing, but actually it's quite often to do with the kneecap tracking, which comes from the biomechanical deficiencies that I'll mention in a minute. My theory is that it's actually just swelling, inflammation that's coming out from underneath the kneecap into that, and it's presenting that itself in that region, or it's just referred.
So before we go into how to fix those knee problems, so Joe showed us exactly where the pain might be. If I'm running and I feel a bit of knee pain, what should I do?
Stop.
So we see that all the time, kind of people, oh, there's a bit of a knee pain, they keep running, and then the problem just gets worse. So here, we kind of recommend, make sure you stop straight away, maybe give it 1 or 2 days to rest, get the inflammation a bit down, and then we're going to stretch it out before we're going to build some strength into it, so it's not going to happen again.
Yeah, so one more thing, lad, before we move on. Quite often the pain is when you're running downhill or uphill is when you'll start to feel these pains, or doing squats. So if you are feeling pain with running uphill, downhill, squats, don't stress. All this stuff is very fixable, and exactly what Vlad said is you stop running and you start doing this program we're about to give you. Now quite often the tightness, quite often the underlying cause of all these knee pains are foot imbalance or foot lack of stability and control, and pelvis imbalance, lack of stability and control. Quite often it's not actually anything to do with the knee per se causing the problem. It's actually the foot and the pelvis causing the problem. Now, those foot and pelvis, I guess, suboptimal sort of positioning and control usually causes tightness through ITB, lateral quads, upper glutes, weakness in the bum muscles, and also weakness in the foot. So we're going to give you some stretches and some ways of lengthening these muscles, which would tighten because of these two things, to help relieve the symptoms. So you can start doing these, like let's say, a day or two after you experience the pain, or straight afterwards actually, because they're quite gentle. So we're going to start with some stretches, and I'll get Vlad to show you them first. So the first one's in standing, and it's actually stretching the outside of his leg.
So I'm going to stretch my left leg here.
Yep.
So to stretch my left leg, I'll start with crossing my right over my left. I'm going to make sure that both my legs are straight as I go down. I'm going to hold this for a few seconds here just to open up a bit of that hamstring.
Make sure you're relaxing your head, and you can hold that with the remedial stretches, a few seconds, but also you can increase it up to a minute, 2 minutes, because we're actually trying to really lengthen those muscles more than we would be otherwise.
And then from here, I'm actually going to turn to my right-hand side. I'm going to try and reach as far as I can along the ground. Some of you might not be able to reach the ground, so see if you can grab onto your ankle, your shoe, your foot, anything. You'll start feeling a really, really nice deep stretch. It goes from your ITB all the way to the glute.
Yeah, it's a really nice stretch. It'll relieve your symptoms quicker than you can imagine if you haven't kept running on a sore knee. So that's great. So you hold that minute, 2 minutes, and you're doing all of these exercises and stretches that we're going to give you. You're doing them as much as you want to and as much as you can, because most of them aren't really you can't really overdo it, but at least twice a day whilst injured. So that's number one. Number two is lay beneath you on your back. So this one here is a nice stretch for more for the side of the hip. We're going to stay on the left leg. So left leg, right leg crosses over left leg, knees nice and close, very important. And then pulling with the right leg, pulling the left leg down and across. So not straight across, down and across. And Vlad should feel that through the kind of the top of the hip, the side of the leg, and probably into the lower back. Now this is a really good one because it can help deal with some of the pelvis malalignment that people get with lots of running. It's very difficult to fix your own pelvis malalignment. So if you do suspect you have a pelvis asymmetry, you're probably going to have to find an experienced, specialized physio or osteopath or something along those lines that can help get your pelvis straight. I can't really teach you anything for that here. So that's stretches. Then we've got one more stretch, which is for the quadriceps, which Van will also show you.
So I've been stretching my quads for a couple of good years, and just standing here in this position doesn't do too much anymore. So to take this a bit to the next level and a bit deeper, I'll just lift my opposite hand. So I've got my right leg bent and my left hand in front. I'm just going to bend a tiny bit forward. So that way here, I can really feel a deep stretch from my hip all the way to the knee.
So good.
So we've stretched that now. So now we're going to get a free massage. So hopefully you got one of them at home.
So
a good foam roller.
It has to be firm, I should say. If it doesn't hurt when you're doing this, no point in doing it. It should be a little bit painful. Now the most important part that I found is between the quadriceps and the ITB, we're at the junction of those two, there's a lot of bristly bits, lumpy bits, I guess. And I find this with anyone that has knee pain, it's really there, and it's really effective if you rub it, or you needle it, or you get your foam roller into it. So basically, you'll be face down, not on the front, not on the side, somewhere along the kind of in between those two, looking for the painful bits. You find the painful bits, and you stick on them until they're not painful.
So the ITB is here, my quad is here, I kind of want to go in between them, is that correct?
Yes, perfect. And the last point you need to release will be above your hip bone here, the muscle called the TFL, more forward, so more through here. You can use a ball, you can use a hockey ball, a massage ball. Most of you have those these days, and just rub it up against the wall or on the ground.
So that's pretty much that area, kind of that.
More forward, so kind of you got your hip bone here,
yeah,
and then you got the front of your hip bone here. It's kind of between those 2 points, so kind of here, right on the side of your hip. Yeah, not so much through the glutes. So that's important too, but for now, with knee pain, this is more important. So that's in terms of lengthening muscles and reducing symptoms. That is the most important things. Now, to work on the root cause of these problems, have a look at the videos of the balance videos, the single leg squat videos, and also the single leg deadlift videos. I give them to all of my patients that have knee pain. Start at the basics, don't rush forward because you create more knee pain, and make sure you get the technique right, because if you're doing it incorrectly, you're going to use your quads, you're going to use ITB, and you're going to create more of a problem. So make sure you look at the technique, start from the start, and work on the technique. So at the end of this video, we're going to put up a summary of that recipe.
With the links to the other videos that would help you kind of build that strength, so that problem doesn't happen again.
Yeah, exactly. So make sure that you look at the summary, follow the summary, and most of you will be able to mostly fix, if not completely fix, your knee pain.
Without seeing your physio.
I'm doing myself a disjustice here, aren't I? If you're worried and you think it's not getting any better, please come and see a physio or a doctor. If it doesn't seem to fit the pattern of the pain here, the pain here, the pain here, and it doesn't seem to be responding like you might imagine, calming down quite quickly, or keeps re-aggravating, definitely go and see someone, because I'd hate for you to go back to running and you've got a torn meniscus or something like that. So just be careful. So
make sure you build that strength. That pain comes usually from not the correct biomechanics, and also maybe a lack of strength and flexibility.
And control.
Control, yeah. So there's a couple of things that you have to remember when you come back from injury.
And quite often by fixing those things, you correct your biomechanics. The other thing you need to look at is your running technique, but we're going to cover that later, and I'll let Vlad cover that in more detail later. So you can check one of the videos later on when we release it. So
we're going to heaps more videos to help you with any injuries. If you have any questions, you can write them below this video, and we'll try and get back to every single one of them and answer to our best ability. Thanks
Thank you.
for watching, and we'll see you in the next video.